sitting here with Dr. Shams Iqbal, and Faith has brought us here to the airport because this busy man is almost late for his flight. But we're here, and first off, I'd like to congratulate you for completing your first PMC.
Thank you.
The Pan Maaz Challenge is a non-profit organization that brings cyclists from all over the world together to help fundraise money for the Dana-Farber Cancer Institute. And their founder, Billy Starr, since 1980 has helped this cause by funding over $1 billion.
Yeah, that's true.
These cyclists have many options for routes, 16 of them, and they range from 25 to 165 miles. And this guy here, he chose the hardest one, 165 miles in 2 days, 265 kilometers. And I know you love, you enjoy spreading awareness about cancer, and you have experience, clinical interests in the liver and cholangiocarcinoma. Can you tell us why cancer is important to do research upon, and can you tell us what exactly you do?
Thank you for supporting the ride to start with, and yeah, that's a pretty profound question, because cancer, as you know, is a very distraught diagnosis for anyone who comes up with this diagnosis. It shakes the patient, shakes the family, shakes everyone. And we have seen an uptick in the rise of cancer because of a bunch of things, including environmental and a lot of other issues. But there's been a rise in the incidence of cancer in the last few decades. So this is an ongoing fight, and we all try to figure out how to manage it. And anyone who has a diagnosis in their family or their friends, they know how challenging it is. So we, at the forefront of the cancer research, we try to figure out ways by which we can help multiple ways. My work is on cholangiocarcinoma, predominantly dealing with early diagnosis and finding markers of potential treatment, because that's the challenge in this specific field. However, coming back to the Pan Maaz supports the entire scientific community who is working on oncology, so that they can figure out ways of, by supporting the early diagnosis, new markers for treatment, diagnostic tests, treatment, care, and palliative care at the end. So it's a whole spectrum. So Pan Maaz has done a great job, and as you already mentioned, Billy Starr's process has reached to the point that this was the 1 in a billion run, and I'm glad that I'm a part of that, and we raised, in 45 years, he has raised $1 billion.
Yeah.
Thank you.
So, I know you're based out of Newton Wellesley, part of the Mass General Hospital network. Can you tell us about the research you've done and shared across the world? Recently, where have you been?
So I try to so being a part of Mass General, and our appointment is through the Harvard system, we are privy of a lot of research opportunities and options. My lab is one of the biggest lab which deals with nanotechnology diagnostics in oncology. I'm working with Dr. Ralph Weisletter. He's one of the world leaders in these things, and with this comes a lot of responsibilities. And in addition to that, what I do is a minimally invasive protocol. Everything the operations and surgeries I do is all minimally invasive, and they are all replacement for open surgeries. We're trying to push the envelope, and this is a very novel way of managing things. And being a part of interventional radiologist, my role is to try to develop this field all across the world. I play the role of the liaison for global outreach at SIR, which is the Society of Interventional Radiology, the American Society. Through that, I travel all around and try to figure out ways to help countries which do not have all the resources. In addition to that, we are trying to help them in a way that they can fulfill their potential, and also at some time learn from them with their disease expression, their history of the disease process. We learn, and then this interaction is very beneficial for the learning, and this way we can push the field further ahead.
I see. So why exactly should someone outside of the places you go, for example here in the US, why should they be worried about helping develop interventional radiology programs across the world?
So again, we are humans. We are one big network of humanity, and all of us have a very deep inherent desire to help others. It's just like how we are hardwired, if you say so. And I am blessed with the situation I am in, the position I am in, and the skill set I've been blessed with. I feel the onus on me that I am responsible. Like with success comes great responsibility, and I live by that adage. So I try to help people because I come from India and I know how the have-nots suffer through things, simple things, wrong diagnosis, wrong treatment. So I feel the onus is on us to try to help them, give them back. So one of my biggest project is known as Give Back, where I send interventional radiologists / interventional oncologists all over the world who spend a couple of weeks with the system, like in Africa, South America, Eastern Europe, and help them reach their potential. And in addition to that, I also overview and try to figure out how they can better improve working with the international governments, funding and everything else, policy making, everything.
I see. So you mentioned you're from India, right? And you studied at Aligarh Muslim University. So,
I'm proud of it.
Yeah, I've heard you've gone back and forth. You work with their program, and they're a hub of education, right?
Yes, they are.
Similar to Boston, so they must have some sort of cancer institute similar to Dana-Farber.
Sadly, I would have loved to say that the answer to this is yes, but sadly, the answer is no. It's a very piecemeal system there in terms of oncology. Radiation oncologists have a decent presence. Just to give a sense to the uninitiated, oncology is a field, at least from the doctor's side, you need to have at least 4 legs. Medical oncology, who treat by chemotherapy and medication and immunotherapy. Radiation oncology, who treat by radiation. Interventional oncology is who we are. We treat by novel techniques. For example, we have mechanism by which we can ablate the tumor, burn inside out. We can freeze the tumor from inside out. We can dissect the tumor. We can do a lot of things. In addition to that, if the tumor is too many, we can treat it from the vascular side and manage that. So, and then there's surgical oncology. We just chop things out.
Yeah.
So you need to have all the limbs in addition to the ancillary support of pathologists, diagnosticians, palliative care, everything, and then floor coverage. It needs a village to serve those patients, and so I'm playing a role on my side, but we need all the things under one umbrella so that we can serve our patient best in Aligarh, because there's a lot of patients who need care.
Now let's move on to racing and training. So you're wearing your Boston Marathon shirt. Is it at all possible that you can compare the two, cycling and running, and your races? How exactly they went for you?
I would say, in terms of intensity, they both were similar. Even though the marathon is much smaller, it's shorter, 26.2 miles, but it's so much labor intensive. It's so much hard on the body. The joints, especially the knees, they really suffer a lot. As opposed to biking, even after about 80 to 100 miles of biking, I never felt the same strain on the system. So I feel both of them had their own role, and again, I like challenges, so I challenge myself with a couple of few marathons, and then now I challenge this year. Because of the Ramadan, I did not do marathon this year, so I ended up doing this, and I feel like I really find my niche, and I really like the way biking goes, and it's a little less intense on the joints. However, the training is the same way. You need to really struggle and strive hard for 6 months before you can really hit the road.
Yeah, makes sense. But I'd like to know what exactly was the hardest part for you in that race.
Again, I'm not a crazy good biker. I just do it with passion. I make it up for the passion by passion. The hills were the hardest, especially the third limb on the second day. There were so many hills that I was almost like getting anxious that I do have to do something to stop. And because I had promised myself that once at every stage there were water stops, so you can stop there. But at others, I do not want to unclip.
Yeah.
So there was a couple of hills where like I felt like I might have to push off, but luckily I persevered. That's what we learned in our AMU Gen MCH times.
Yeah.
So perseverance pays, and alhamdulillah, we pulled it off.
Yeah, that's good for you.
Thank you.
And I know a lot of our audiences, some of them, they're on the younger side. And they're unsure with college app season. They don't know exactly what they want to do for a career, or they don't know how to balance and focus on their passions. So, do you have any advice for them?
I think it's a pretty good question. In fact, it's a great question because they're staring at the whole life in front of them, and it's very challenging situation. And most of them don't have much clue.
Yeah.
So the real challenge there is like to know yourself, like who are you, what do you want to do, because everybody has different personalities, different ways of approaching it. At the end of the day, you want to accomplish something which is beneficial to the society and also helps you. For example, medicine is a very classical way of like, again, it might sound cliche, I might sound biased, but we are one of the most stable industry ever. Wherever you go, like we never have a risk of being fired, we never risk of losing our jobs. As long as you do a great job, you can keep rising and you can do a great job. And it depends, like if you want to go into academics, that's where I came back, and then you can go to private practice, make a lot of money. But it all boils down to the fact that who are you, how much you like doing that. So ask this question to yourself, figure out who you are. Some people love finance, more power to you, do it, we need it. Like journalism, like there's so many things needs to be done, just do it. But the only one thing which I must say, and which I tell to my kids also, like whatever you do, try to be the best in that. The rest will all fall into place.
I completely agree. Yeah. You should always try to strive
for the best. I would like to thank my wife who lets me do all these crazy things. She's an angel, and my kids who are always supportive of me. I would like to special thanks to Kim, who has been a great support for my research. She has provided us with the Jerry Fund in our fight against cholangiocarcinoma. Shout out to my seniors and colleagues and juniors in Amana. Thanks to Sushil Tuli, who has always been a big support for all my rides and runs. Arshad Bhai was a big support in this Pan Mass Challenge. He himself is an avid rider. Mohsin Bhai, who has always been a pillar of support, and all my colleagues who have always covered me whenever I needed to do something extra. So thanks to everyone, and more to come. Thank you.